Hi everyone, welcome back to my channel. Medication calculations can be the difference between a pass and a fail in your placement. Today I'm going to show you the 5 mistakes I see students make all the time. If you can avoid these, you will be the most confident nurse on the ward. Mistake number 1 is forgetting to convert units. यहाँ देखिए, the doctor ordered grams but we have milligrams. हमेशा convert पहले करें, always convert first. So 1.5 grams becomes 1500 milligrams, and now the math is easy. 1500 divided by 500, it will be 3 tablets. So this is easy, you can do, but always remember that what have doctor charted and what the tablet you have. Never write a neck decimal. अगर आपने सिर्फ 0.5 लिखा and the dot is small, it looks like 5 mg. That is 10 times overdose. Safety protocol says always put a 0 first. So you will write 0.5 mg or 0.5 ml. Don't round your numbers too early in the calculation. If you round in the middle, your final dose will be wrong. Final result tak wait करें, wait until the final results. Then round to one decimal place. So you can see 6.666 will be 6.7. So it will be our final accurate dose. So never be confused with the 7 meal. So it will be 6.7, right? Many students forget the volume part of the formula. So you need to know the formula simple hai what you want. What you want means doctor what have ordered for the patient and divided by what you have in the cupboard or wherever you are getting the medicine times the volume. So 125 divided by 250 is 0.5, and then if you multiply with 5 mil it will be 2.5 mil. So वॉल्यूम को मल्टीप्लाई करना भूलना नहीं है. The biggest mistake isn't math, it's pride. Never hang an IV bag or give a complex dose alone. Always ask a colleague for an independent double check. Do this is better for patient safety. Always double check. Never administer any medication which have higher risk by your own, even you are confident. And it should be with the protocols of hospital and protocols of the state you are working. Thanks for watching this video. You can subscribe my channel for more informative videos, and if you find any valued information in this one, please like and share the video. Thank you.